Okay. And I also want to let everyone joining us today know that we have Spanish interpretation available if you're joining us on Zoom. At the bottom of your screen, you can click the interpretation button and select Spanish to hear live Spanish audio interpretation. We also have ASL interpretation on the screen. And as I mentioned, later on, you will have a chance to ask your questions of Dr. Chan. And to do this, you can click on the Q&A button at the bottom of your screen on Zoom and type in your question, which will then read aloud for Dr. Chan to answer. Or if you'd like to ask your question verbally, you can click the raise hand button. A little hand will pop up on your name. I'll unmute you, and that will allow you to verbally ask your question. So with all of that, I'm now very pleased to welcome and introduce Dr. Philip Chan, the infectious disease specialist and consultant medical director for the Rhode Island Department of Health, who has the information that you came to hear today. Please take it away, Dr. Chan.
Great. Thank you so much, Mark. It's a pleasure to be here. I'm thrilled to give this presentation today. I do want to say, we've tried to do our best during this pandemic. I think it's been challenging for everyone. I do encourage people as I go through this presentation, please do ask questions. I think that any and all questions are fantastic. We've tried to be transparent during this time. We've tried to make the best decisions as possible based on data, based on science, and we've done our best. And just reminding people that none of us have been here in this position before. So we're still learning. Every day I'm learning. We're all learning about how to best navigate this pandemic. So thank you again, everyone, for your time and patience with us. I have a couple slides I'm going to go through. So I'm going to share my screen. Hopefully this comes right up on the screen. Please let me know if this is not visible. But I'd like to first start off by saying we're in a good place right now. And this is fantastic. We've seen a decrease across the board in cases, in hospital admissions. We've seen our percent positivity of tests, that's a key marker we've been following, fall below 2%. It's been as high as almost 20% during some days, but we're now below 2%. So we're in a good place. I do also want to say, though, that as people get that itch to open up, and I totally understand it, and a lot of states, including us in Rhode Island, are starting to pull back a little bit. And I just want to remind people that these variants, these mutations, these mutated strains of COVID are still a concern, a very real concern. In fact, if I had to point at something now, that what's the most concerning thing about this pandemic, it would be these emerging variants. And so we still need to be a little bit careful. We'll talk about vaccines. I do think very optimistic. I think vaccines are what's going to end this pandemic. I think that they're in the light at the end of the tunnel. But I want to let people know that we are still, what I believe, and I believe most experts across the country, that we're in the fourth quarter of a basketball game, right? We're in the fourth quarter of a football game. We're not quite there yet, but we're almost there. And so we just need to be patient for a little bit longer. We need to wait until this vaccine, these vaccines are here, and all people have access, and we'll talk a little bit about that. But the exciting news, I think, for those of you that have followed, is that a third vaccine was just approved. The Johnson & Johnson vaccine was just approved. It's very exciting. The Biden administration came out yesterday, the last couple of days, saying that all Americans should have access to a vaccine by the end of May. So that's a much more, a shorter time frame, sped up timeline than we thought. So I think we're almost there. And just encouraging people to just stay patient a little bit longer until we get these vaccines out there and everyone has access. Specifically, I think for this age group, as we talk about younger individuals, I will say a couple things. First is that people should keep in mind that these vaccines are not approved for people under the age of 16. So even if we wanted to, we can't give them to people under the age of 16. They just haven't been studied. The Moderna and the new Johnson & Johnson vaccine are approved for people age 18 and older. The Pfizer vaccine is approved for people 16 and older. So just keep in mind, again, even if we wanted to, we wouldn't be able to vaccinate people younger than 16. I will say the studies are ongoing now, so this is good news. Johnson & Johnson, Pfizer, Moderna, all of them are actively studying these vaccines in younger people, people under the age of 16. It's still going to take some time. The process is a little bit more rigorous for kids, which I agree with, and I think it should be, right? I'm actually the father of a 9 and a 13-year-old, so I certainly want to make sure there's no question about this vaccine before it's given to my kids. But the data is coming. So I anticipate maybe by fall, maybe by early 2022. So we're still talking a little bit of ways off before these vaccines are going to be authorized for people under the age of 16. Just one thing to keep in mind as we chat through this. The second thing, as I go kind of through this, just as to take a step back, how are we thinking about vaccines? And here in Rhode Island, early on, we came up with these 4 guiding principles in thinking about how we want to implement vaccines in the state of Rhode Island. These are the 4 principles. The first is safety. I want to reassure people that these vaccines have met every single safety and rigorous review process that there is. There's been no shortcuts for these vaccines. They've been reviewed by scientists. The studies that have been done are the same exact studies that are done for any vaccine. They've been reviewed by the FDA, by the CDC, and even by our own statewide subcommittee has reviewed the data as well. And they are safe. And at least for the Pfizer and Moderna vaccine, I would remind people that these vaccines have now been administered to millions of people, millions upon millions. And we're not seeing anything unexpected. These vaccines are safe. I myself have gotten the Moderna vaccine, 2 doses, 28 days apart, as recommended. I, similar to a lot of people, had arm pain, I had fevers, I had chills. I felt crummy for a couple days. But that's expected. And that shows that my immune system was building up antibodies, building up an immune response so that if I was ever exposed to the actual virus, then my immune system would already be in place and it would prevent me from getting sick or even infected. So just want to really hammer home that point. I mean, these vaccines are really safe. They really are. I mean, millions upon millions. And also to remind people that no vaccine has been under more scrutiny than these COVID vaccines. So everyone is watching these vaccines super closely. And I feel like at this point, if there was something unusual or weird, we would have caught it by now. The second principle that's been guiding our vaccine implementation is to minimize morbidity and mortality. And that means that, which I think should make sense, that means that we really want to prevent people from getting sick, from being in the hospital, and from dying. And that's why in the state of Rhode Island, we really have prioritized older folks. That is why, in general, older people are being prioritized. We know that, if you look at the data, the science, the older you are, the more likely you are to die. It's just, it's what this virus is doing. If you are over 80 years of age, you have a 15 to 20% chance of dying from this virus. And we've seen in Rhode Island and as across the country, we have just seen terrible death rates in places like nursing homes, et cetera, because this virus is so deadly, especially to older folks. We'll talk a little bit about this. We also know that this virus, as with a lot of viruses, affects people that have other health conditions. And so we'll talk a little bit about that and then how we're thinking about how we have thought about rolling out vaccine here in the state of Rhode Island to those with other health conditions. The third component is that we want to make sure that there's an efficient system of distribution here in the state of Rhode Island. One thing that's happened early on, again, here in the state, is that we were a little bit slow in our number of doses administered. The reason for that is because we had a very targeted approach. We were targeting people over the age of 75, healthcare workers, and it took time. We've also been focused on communities that have been hit the hardest, those in high density communities, specifically those in Central Falls, Pawtucket, Providence. If you look at who's been affected most by this pandemic, it's really been people in some of these more dense urban settings. And that makes sense, of course, as people that live in closer proximity are just more likely to transmit the virus. And so we have doubled down to try to get virus to communities that need it most. The other thing that we've realized during this pandemic, and there's a commitment here at the Department of Health, is that African American, Black, and Hispanic Latino communities have just been hit hardest. And that means they're more likely to be positive, they're more likely to end up in the hospital, et cetera. And part of that is because of a lot of these structural factors we've been talking about, where they tend to live in more dense urban settings. And that goes into my fourth point, is that here at the Rhode Island Department of Health is, regardless of a person's background, we really want to make sure that all people have access to this vaccine. And again, just thanking people for their patience. We at the Department of Health are absolutely thrilled that so many people want this vaccine. It's great. It's a public health win. We want to vaccinate everyone. We are only limited by the supply that we have. And that has been the main limitation in terms of getting vaccine out to all people. I do want to say, with the Johnson & Johnson vaccine being approved, with improvements in manufacturing processes with the other vaccines, Moderna and Pfizer, we are in a fantastic place as a country. And per what the Biden administration has promised, by the end of May, which is not that far off, everyone should have access who wants it to a vaccine. So again, thank you everyone for your patience. We are getting there, which is exciting. We're almost there. What's coming up, and of course, the main questions on the table are, when will I get my vaccine? So we anticipate in the very near future, certainly by May, is that all age groups will be opened up. What you can see here is a timeline that has been based on our current supplies with the Moderna, with the Pfizer. The one group that's going to open up in a week or two is going to be all ages. Again, 16 is the cutoff, but all ages with underlying health conditions. So that's right around the corner. That is literally the next group. And we're on the verge of opening it up. Again, the timeline is going to depend a little bit. We're going to obviously open it up as soon as we can. The timeline is going to vary a little bit depending upon the demand in the current group, those who are 65 years of age and older. So how are we thinking about underlying medical conditions? Here on the screen are the categories, the recommendations by the Rhode Island Department of Health of what an underlying medical condition looks like. The conditions include diabetes, type 1, type 2, lung disease. You can see a number of different types listed here, but I'll point you to the fourth bullet, which is, in general, people with significantly decreased lung function. You can see this is also reflected in heart disease and kidney disease, where people with significant heart conditions, people potentially with chronic kidney disease, is that qualifies as an underlying medical condition. You can see in the fifth category here, it's classified as a person with a weakened immune system. Cancer, people on chemotherapy or radiation, people who have had or are waiting for a transplant, HIV/AIDS, sickle cell, people that have a disease that weakens the immune system, or people that take medications that weaken the immune system. I also want to say what's not listed on here is that we are currently discussing other groups as well. We know, for example, that people with obesity are at more risk of severe COVID. and dying. So we are looking at expanding this list. I will say that nothing is final. We're still in the process. And the other thing that the other way that this is going to work is that people should ask their doctors if they qualify. So here's our stance at the Rhode Island Department of Health. We want everyone to get the vaccine. We understand that there's a lot of frustration and anxiety and impatience, but we just don't have the staff to micromanage every single person, to review every single individual that may have an underlying medical condition. So we have asked the clinical community that if you have questions about whether or not you qualify for a medical condition, to check in with your doctor or medical provider. We are also saying that you, as a person signing up for a vaccine, can self-attest whether or not you have an underlying medical condition here on the list. What that means is that you do not need a doctor's note. What we're asking people is, if it isn't clear, if you are unclear whether or not you have a health condition that should qualify you to get a vaccine, is you should ask your primary medical doctor or provider. We've received feedback, and which I agree with, certainly as a physician, that the clinical community just does not have the bandwidth to write a doctor's note for every patient who could possibly qualify with an underlying medical condition. And I agree with that. So we are not asking people to get a doctor's note. We are asking the clinical community that if people have questions, then they should call their provider office and just discuss next time they're there. Just ask, talk about your medical conditions, and based on that, if you should get a vaccine. I will also say that we're always constantly looking to update this and discuss. But at the end of the day, we're trying to minimize people in terms of having barriers to obtaining a vaccine, because we want everyone to get a vaccine. We are asking people to demonstrate some integrity and honesty with this system. Obviously, there's a potential for abuse. We decided that despite that, we were going to rely on people's goodwill and honesty. And of course, if people are abusing the system, they should let us know. And we always leave the door open for some degree of enforcement. But at the end of the day, we want people to get vaccinated. We need to work together, both as a community, also with the clinical community. And again, reassuring people that we're going to get there. And hopefully all this will be a bad memory in the not too distant future. In terms of side effects and safety, wanted just to touch on this because I know that this has been a concern for a lot of people. Again, the only side effects, the main side effects, are that people feel a sore arm, some body aches, maybe low-grade fever, chills, and fatigue. Again, it's normal. There is a very small number of people that do have an allergic reaction to these vaccines, and I mean a very small number. It's something like 10 to 12 people per 1 million doses administered. And that's also somewhat normal. It's people have been allergic to vaccines, a very small number. And if you are allergic to any component of these vaccines, you should not get it. If you have developed an allergic reaction to the first dose, you should not get the second dose. But that's it. That is the only hard contraindication to getting this vaccine. If you have allergies to other things, food, nuts, other medications, you can still get a COVID vaccine. If you have allergies to other vaccines, you should check in with your medical provider just to double check, maybe an allergist, but you can still get the vaccine. So again, people should really, if they have any questions, again, talk to your primary care provider, talk to a healthcare professional. But there's really only one contraindication to the vaccine, and that's if you're actually allergic to the COVID vaccine itself or a component of it. is the COVID-19 vaccine safe for teenagers and adolescents? Kind of went over this. Again, authorized, the Pfizer's authorized for people age 16 and older. Moderna and Johnson authorized for people age 18 and older. And the studies are underway for people that are younger than that. The other thing that I'll mention is that there is a vaccine interest notification list. So this is a email list, actually, where you can go on to portal.ri.gov. It's the same website we use for testing. You can sign up to be notified when you are eligible to be vaccinated. And just to be clear, this does not mean that you are guaranteed an appointment. It's a notification system that you are now able to sign up to be vaccinated. We're also working with cities and towns, and I would just ask folks to also check in with their city and town, with their website. They may have their own notification lists, and we are allocating a smaller supply of vaccine to the cities and towns to distribute to people as they see fit. So I think I'm going to end there. I see a couple questions popping up, but I am absolutely thrilled to answer any questions. I will leave folks with the general contact information here at the Department of Health. We have a phone number which you can call if you have any questions about vaccines or frankly anything. That number is 401-222-8022. And we have an email for questions. You can also email us, and we have an entire team of folks that have been well trained, and certainly if they don't know the answer, they bump it up to one of us. But rido.covid19questions@health.ri.com. So we're doing our best to address people's concerns. Again, I think as with a lot of things in this pandemic, there's been so many challenges. We've done our best. We thank people for bearing with us, and we're getting through it. And I really do think we're almost there. So at this point, I'm happy to answer any questions. Mark, I'm happy to read them off the chat here, or if you want to ask them.
Sure. So we have quite a few that folks have sent in, and we really do appreciate your questions today. We'll start with this question that's been typed in. My son, the questioner writes, has severe autism and is nonverbal, 16 years old, doesn't understand social distancing, can't keep a mask on. How is the vaccine going to be distributed to this population? Will there be drive-throughs? Will it be administered like a flu vaccine? There are a few similar questions about this particular population.
Yeah, great question. So if possible, we've set up 2 mass vaccination sites. So we have one at Stockanasset in Cranston. We have one at the Dunkin' Donuts Center here in Providence. We're in the process of setting up a couple more. So there's going to be one in Southern Rhode Island and Northern Rhode Island. We are identifying and working on sites there. And so people will be able to go online or call a phone number to sign up for that. So people can go to vaccinateri.org. That is the main way that people can sign up for mass vaccination site, vaccinateri.org. Or you can call a phone number, 844-930-1779. And people can go to our main website. So people can go to the main Department of Health website if you want to Google that. And all this information will be available on those sites. For people that are homebound, for people that can't leave their house, in the next week or two, we will have a service where where we can go out to people's houses to vaccinate them. So we're trying to work on all the angles here. There's definitely, again, it's a work in process. We've never done this before, but we are trying to make this vaccine as accessible as we can. And so the 2 other sites that will be opening soon will include Middletown, where Benny's used to be, and the other's in Woonsocket. And I think it's going to be at the corner of Mendon Road and Diamond Hill. So Diamond Hill Road. So eventually we're looking for 5 mass vaccination sites strategically placed throughout the state so that people can go to.
All right, very good. Thank you. Probably the top question right now from multiple folks in the audience is asthma. Is asthma considered an underlying health condition? Is it considered lung disease, which was one of the conditions you had listed?
what's the status of asthma? Yep. So good question. So, and that's why I try to emphasize if people have significant anything disease, so it could be significant asthma, significant, anything, then yes, they're going to qualify. I guess what we were trying to get at is that, there's a number of people who have, myself included, that had very mild asthma, reactive airway disease growing up, right? So I wouldn't, my lungs are fine. I go running every day. So for people that have a very mild history of asthma, don't use an inhaler, never have a problem with it. That's not necessarily the group that we mean by underlying health conditions. If you use an inhaler, absolutely, you qualify. If you have any degree of decreased lung function, yes, for sure. And if you have any questions about whether or not, you generally meet these recommendations, check in with your health provider. Again, we are trying to cast a wide net. We want everyone to get vaccinated. What we are trying to avoid is people abusing the system where, at least as an adult, an adult that was had a mild asthma as a child and no longer has any problems, you probably, by the spirit of this, don't qualify as an underlying health condition. That's what we're trying to get at. Okay, very good. We have a couple of folks who have their hands raised and they'd like to be unmuted to ask a question. The first one is E. Clark. I'm going to click and ask you to unmute E. Clark, and you can ask your question.
I apologize. I'm driving. I must have hit that button by mistake. I apologized. I'm driving. I probably hit that button by mistake.
Oh, okay. Very good. Sorry. Thank you. So the next person I have is Danielle Harris. I'm going to ask you now to unmute, Danielle, if you'd like to ask your question.
Yes. Hi. Can you hear me?
Yes. Go ahead.
Okay. Thank you. Just two related questions. The first is I'm a caretaker to my 7-year-old son with special needs who is considered high risk. Would I qualify as being someone that at this point could get a vaccine since I'm his direct care at home?
Yep. So to answer your first question, we are actively discussing that. I think as you're alluding to, the state of Massachusetts has allowed caretakers to be vaccinated. So we are hopefully going to do that. I can't promise anything yet, but it's under active discussion.
Okay, thank you. And my other question was just in relation to him. He's only 7, so he doesn't, meet the cutoff. Are they doing studies now for the children, or, when would that possibly happen for him?
Yeah, so great question. So for a 7-year-old, we are looking at probably later fall, if not first, beginning of 2022. So it's still taking, those studies are undergoing as we speak. So it's going to probably be a period of time, at least 6 months, before we see kids for a vaccine authorized for kids. It's coming though. They're working on it. That's one of the messages too, is that all these companies are working on it. But there's an increased degree of scrutiny that takes place for vaccines for kids. It's coming though.
Okay.
Thank you for your questions.
Thank you.
Okay, great. Next, Kay Carrot is the name that I see on the screen. If you would like to go ahead and ask your question.
Hi, thank you. I was just checking in. My daughter has, she's 17 and she has underlying health conditions and takes an immunosuppressant as well as has asthma. But she also has a number of allergies and food allergies and carries an EpiPen. And I know there's been reactions, so we're considering that the Pfizer vaccine for her. But they were recommending initially that for people who tend to have allergic reactions, do it close to a hospital setting, if not in a hospital setting. Are there options like that?
So I would be comfortable, I would make sure to be vaccinated at one of the state-run sites. We've worked with the state sites. There's actually a medical director and healthcare professionals right on staff. Since we're actually only vaccinating at 2 sites at the moment, we're going to open that up, is that we've made sure that those 2 sites that the people are well trained to deal with this. So I would feel reassured personally about going to the state sites. You'd probably want to be careful, for example, about going to a smaller community sites. There may be a time in the future where we have smaller community sites open. I would maybe be a little bit more careful about those sites. But certainly for the state sites is that they are well staffed and trained to be able to respond to anything. And again, certainly it's a valid question, very reasonable question. If you have any concerns, please do discuss it with your primary care doc. And if you feel like you even need another opinion, I would discuss it with an allergist.
Okay, and so the 2 state-run sites are the Dunkin' Donuts and the Sacanasset?
Correct.
Okay, all right, great, thank you.
You're welcome.
Okay, so I'm going to switch over to some of the other questions that have been typed in for just a few, and we definitely will get to you if you have your hand raised. I have a 17-year-old with Down syndrome, one person writes. What percentage of special needs youth were part of the trials for the Moderna vaccine?
It's a great question. I don't know the answer. I'm guessing probably not a lot, and it probably wasn't intentional. I do know they looked at people with other health conditions, et cetera, but I don't think it's something they specifically looked at. So certainly an area for future research.
Okay. Question about diabetes. I have a 17-year-old with type 1 diabetes. When is the expected date for this group's registration to open? And they also ask, and I think a couple other folks have asked this, the announcement of teachers being prioritized, is that going to delay other groups?
Yeah, the answer is it shouldn't. The thing that was unexpected but graciously received is that the Johnson & Johnson vaccine was just approved. So as we're thinking about who to vaccinate and logistics, we have this bolus coming in of Johnson & Johnson vaccine, and also Pfizer and Moderna are increasing, their doses to us over time. So we're in a good place. As we consider teachers, we are also making sure that our timeline for other age groups can be met as well. So I don't anticipate any big hurdles to that. Okay,
very good. A couple of folks in the audience asking about cerebral palsy. My daughter is 17 with cerebral palsy. I'd assume this is considered an underlying condition?
I would consider that, yes.
Great, okay.
I guess also with the point that there's a spectrum of disease with cerebral palsy. So again, I would consider a lot of cases, most cases. I would just, again, make sure to check in with your primary care provider if there's any question. But in general, the answer would be yes.
Another parent asking about cerebral palsy, talking about their child who's very thin, only 80 pounds, asking, is it safe for a person who's below average weight to receive the vaccine?
Yeah, I think one thing to keep in mind is we are giving this vaccine as fast as we can to older individuals, many of them who are really frail and underweight. So I think it's a consideration for sure, but I wouldn't, especially in a younger person who may be underweight, I wouldn't let that in of itself hold you back. But of course, any questions, please check in with your primary care provider who obviously knows you the best.
Okay, very good. I'd like to unmute. I have Kimberly Rivers on the screen with a question. I'd like to go ahead. Kimberly, if you'd like to unmute and ask your question.
Hello, can you hear me?
Yes, we can hear you.
Okay, great. I'm the parent of 16-year-old twins, one of which is type 1 diabetic, and the other has had 3 occurrences of Stevens-Johnson syndrome. The first was attributed to an allergic reaction to ibuprofen and then generalized to NSAIDs. The second 2 were due to an inability to fight mycoplasma bacteria. She was hospitalized twice, the first 2 times. The last time she wasn't hospitalized, but the time at home was no picnic. My fear is that will this vaccine potentially trigger something in her body to result in another instance of Stevens-Johnson?
Yeah, great
Is
question.
there that possibility? Yeah.
Great question. So, for those of you who are not familiar, Stevens-Johnson is a type of severe skin reaction that can be, can be after certain medications, certain infections, etc. So, the answer is we don't know. Again, there's so much about this that we don't know. I would say, is the risk zero? I would say the risk is really low, but I would say that if your child has had this before, there is probably a risk. It is, Stevens-Johnson syndrome is thought to be immune related, and it can be triggered by certain things, which I think is what you're suggesting, and spot on. And so there's always a potential. So I think in that situation, I would really weigh the risks and the benefits. I would certainly talk to your primary care doctor. And I do think that in general, the overall risk is low. I have not heard personally, I tend to get referred all the unusual things, or at least hear about them. I have not heard anywhere about this vaccine causing Stevens-Johnson syndrome, or even a concern that it may have. So that's obviously reassuring. But there is probably still a small risk. I would say the other thing, though, for folks to keep in mind is that I have not had COVID, and I wouldn't want it. And I think especially depending on other health conditions and folks, is that just keeping in mind that, that COVID itself can cause severe, persistent symptoms. It can obviously cause very severe disease. So I think it's a risk, it's a risk benefit assessment. And overall, I think the risk is low. But again, just to also frame some of these questions, we live in the United States. No one's going to force anyone to get a vaccine. So it really is all personal decision. And obviously, these are all great questions. And some of you out there may decide not to get the vaccine. And you know what? That's okay. Because again, we live in the United States of America. But just make sure, encouraging people, as it sounds like everyone here is thinking it through, to base those decisions on science and facts and data, understand the risks, understand the benefits, and then make your decision. It's less helpful, and it's a little bit depressing to me when people base their decisions on misinformation or myths. And so just encouraging people to stay to the facts, make sure they base their decisions on the data. So thank you for your question.
Could you tell me what the vaccine is made out of, and if there are any particular components in there that could result in an adverse reaction? So my fear is not only with the Stevens-Johnson for one daughter, but the inherent risk of maybe triggering a case of DKA in the one with type 1 diabetes.
Sure. So these vaccines actually don't have a whole lot of ingredients. So if you look at the Pfizer and the Moderna vaccine, they have a very small piece of RNA, right? And so that's the viral genetic material, a very small piece. First off, they don't even contain the entire virus. There's no way that these vaccines can actually cause infection. That's just one myth that's out there. It's a very small piece of the existing viral RNA. They take that viral RNA and they wrap it in fat molecules. It literally has fat, and very small amount. It's not going to make anyone fat. And basically, the reason why that happens is because it's been found that it needs that lipid component, it's called, right? Fat molecules. It needs that fat for cells to take up that viral RNA in order to express it, make the viral protein, and generate that immune response. So there's fat molecules, very small amount. There's RNA, there's water, and there's some sugar. And the two components that people sometimes are allergic to are called polyethylene glycol, or PEG, PEG, and polysorbate. And those are the ones that usually generate an allergic reaction. So those are in other things as well. If people are known to be allergic to polyethylene glycol or polysorbate, then you should not get the vaccine. That's one of the hard contraindications. But that's it. So again, low risk overall. Maybe a dozen people per 1 million doses administered, which is reassuring. So low risk in general, but it does happen. It's definitely one of the concerns. And again, it comes down to really a risk-benefit discussion in a lot of people.
Okay, very good. And since you mentioned allergies, one of our questions is asking about an adult child allergic to IV contrast dye. Is that have an impact? Is that going to be safe for them to get a vaccine?
So the answer is yes. So literally the only contraindications, again. So, again, there's so many people out there. You can be allergic to just about anything in life, right? I mean, literally, there's someone out there allergic to at least one of everything in life. But so IV contrast dye, other vaccines, other medications, pets, food, anything else. Literally, the only reason not to get the only true reason not to get this would be if you're allergic to polyethylene glycol, polysorbate, or another component of the vaccine, like literally allergic to the COVID vaccine itself. So if you do have an allergy to anything else, IV contrast, anything else, it's a consideration, but it's not a contraindication getting the vaccine, meaning you should still consider it. And lots of people are getting these vaccines with allergies just like that, and they're doing okay.
Okay, very good. We have a lot of questions coming in. Very good questions. We're going to try to get to as many as we can. A few that are kind of along the same lines is asking about sort of special needs populations who maybe don't do well in situations where the vaccine is administered. So whether it's waiting in a long line or being in a crowd with a lot of other people. And one of the questions that a few folks seem to have is, are there going to be people on staff at these sites that can sort of help assist with some of those populations? Or are there going to be perhaps even alternative venues where those folks can get the vaccine?
Yep. So good question. So I will say that these sites, the state sites at least, are all scheduled. Meaning when you get there, there's not a huge line. Like you have an appointment, you have time set aside. So you can go right in. The reports, the experiences that people have reported back to me have been all pretty much positive. So there's no waiting, there's no lines, there's no crowds. Obviously, crowds are frowned upon in this pandemic. And there's lots of help. So I would say that it should be okay, not knowing obviously the certain situation. I will also say that as we progress here, that a lot of clinics will eventually have access to the vaccine. We've opened up these mass vaccination sites to vaccinate people as fast as possible. We want to get people vaccinated. We want to end this pandemic, but eventually, this vaccine will be available through general clinics. Is kind of the plan. So we're open to anything. If the people on the call are finding that they are having trouble for whatever reason getting vaccinated at a state site, let us know. Shoot me an email. Give that number a call, or shoot the Department of Health a call, an email. We are always trying to improve things. Obviously, we want to be very sensitive to this population. Give us a call. We'll do what we can to fix it and to make it work.
Okay, good. Here's a question that I think a lot of folks probably have is, once you're vaccinated, are you still able to transmit the virus to other people?
This has been an evolving question. When we talk about these vaccines being 95% effective, it means that it's been 95% effective in preventing people from getting sick, from getting disease. What we're now learning, literally over the last couple of weeks, as more people are vaccinated, is that it's appears to be very good about preventing you from being infected. So getting the virus, period. What we do know is that some people can still get the virus, can still be infected. They may have very mild or no symptoms, and it's unclear how much they can transmit on. So my answer to that question would be there's probably still there is still a small chance you can be infected, and there probably is a small chance that you can transmit to other people. And that's why we're asking people to still be careful at this point in time, even if you've been vaccinated, just wear a mask still. That's easy to do. Physically distance, etc. Don't go to a party, don't go to a concert. We just need to get rates across the state and the country low enough to where those things are safe again. So bear with us for a little bit longer. But the answer to your question is there's probably a chance, small chance though.
Okay, very good. Thank you. I have with a raised hand, Rosa Rosales. Rosa, I'm going to, unfortunately, it won't let me unmute you. Let me see if this will work. Rosa, are you able to unmute and ask your question? You're still muted, Rosa.
My daughter has she's 17. She's almost gonna be 18 years old, and she has Down syndrome, and her immune system is very low. So she's coming back to the high school, and I wanted to know if she's gonna be able to get the COVID vaccine.
And how old is she, Rosa? Good question.
She's gonna be 18 in July 30th.
Yes, she would be able to get the Pfizer vaccine, and she should be able to get it in a couple weeks. She should be able to get it.
Okay,
Yes.
Thank you.
Okay, very good. All right, let's see. Lots more questions. What is the time frame after you're vaccinated? What's the time frame to expect full immunity?
I would say 14 days to be safe, and as a general answer, 14 days after the second dose for the Pfizer Moderna. Also keeping in mind that the Johnson & Johnson is one dose. It's going to be about 28 days after that. Mark, if there's a lot of questions, why don't you ask rapid fire, and I'll try to keep my answers short, and we can kind of just go through.
All right, let's see what we can do here. One person asks, how do they know? So if you have to go for multiple shots and you go to one site and then you have to come back however many days later, how do they know you're getting the same vaccine again, or does it matter?
It does matter. You want the same vaccine. They'll give you a card that clearly labels what dose you got the first time. That card will be documentation you got the vaccine. You should save it. It will be gold. You want to document it. And it will also list the vaccine type on it.
Okay.
Hey, Mark.
Yes.
This is our interpreter. Before we continue, can you spotlight the interpreter, please? Are you able to do that? There's a lot of deaf people in the audience that can't see the interpreter.
Okay.
Spotlight the interpreter. I appreciate that.
I've done that, and hopefully that helps. Thank you.
All right. Thank you.
Okay. So how can a 17-year-old, here's a question, how can a 17-year-old with chronic kidney disease and receiving an oncology drug actually request the approved Pfizer vaccine, or should we just take what we can get?
So a 17-year-old or a 16-year-old should only be offered the Pfizer vaccine. So they have the Pfizer vaccine at the state sites. If you sign up, at least through the state sites, that should be the vaccine that you get. And again, when you register for a vaccine, you put in your age and they'll be aware to give you the right one.
Okay, very good. One person asked, saying that they've heard a lot of talk about the vaccine affecting younger people when it comes to them being able to have children later in life. Is there any truth to this?
So this is the great question. This is the number one misinformation out there, is that this vaccine causes people to be sterile or leads to infertility. So that is categorically false, does not happen. It's been a lie that's been propagated by social media. There's no truth to it. There's never been a vaccine, never been anything that causes someone to be infertile. In fact, a lot of people, not for this reason, but a lot of people would want that. There's a lot of people that want birth control, et cetera. But so this is not true. It's false.
All right. So huge myth busted. Very good to hear. I have another person with the raised hand. So the name I see is G8 Thin Q. I believe that's your model of phone. You can go ahead and unmute if you'd like to ask your question. G8 Thin Q. I'll give you a second there to, it looks like you're on now.
Hello?
Yes, we can hear you.
Okay, I have a question about my son. He's 17 and he sees the endocrinologist at Hasbro. He has primary adrenal insufficiency, Addison's disease, and he also has rheumatoid arthritis, and he takes steroids every day because his body doesn't make potassium or salt. So I just want to make sure that this is recommended and how soon he can get it.
Yeah.
You've heard of that, right?
Yes. Yep, for sure. Yes, for multiple reasons, he would qualify a couple weeks, 2 weeks. So people younger, all younger people with underlying health conditions should qualify in 2 weeks, mid-March. Again, just to remind people that it's for 16 and older. There's a question I just saw pop up in the chat about younger populations, before fall. I would be surprised if there were any vaccines approved for people before fall for younger than 16. I don't think it's going to happen.
Okay.
Mark?
Yes, sorry.
Quick question. There may be a potential that there are a lot of individuals who would like to ask a question from the deaf community, but they're not able to if you have all their cameras locked and blocked. So if I may make a suggestion in all due respect, if you can allow the honor system for those who wanted to auditorily ask a question, can ask it auditorily, not open their cameras, and those who are deaf, they can just basically have access and they can turn on their camera and ask a question. The interpreter will be able to see that and then actually interpret that, because we cannot interpret the questions from the deaf audience.
I see. Unfortunately, because this is a webinar style, it's not easy to allow the audience to turn on their cameras. It's sort of meant to be more of a one-way. I hear what you're saying, though. I'm not sure of another way to work around that, but I think it's something we should definitely consider for future presentations.
Okay, thank you.
Thank you for bringing that to my attention. So let's try to get through a few more of these very quickly. Daughter with cystic fibrosis, 16 years old. I'm concerned about any possible respiratory issues with getting the vaccine. Is this something I should be concerned about?
So the virus itself does not cause respiratory issues. So a side effect of the vaccine is not respiratory issues. In fact, if you get respiratory issues, even though you've had the vaccine, you should get tested for COVID and other things as well. So the vaccine generates, remember, it's injected into you, so you're not inhaling anything. And when you inject the virus, the viral genetic material, that's where you get sort of the body aches, the fevers, the chills, the feeling crummy. That's your body responding.
Okay. How will the population of young people age 16 and over register for the vaccine? Do they go through the same system that adults go through online, or are there other places in districts or schools or anything like that?
At this time, it's going to be the same process. So again, to sign up, to be notified, go to portal.ri.gov. And to sign up when the time comes in a couple of weeks to actually sign up to be vaccinated, go to vaccinateri.org or call the phone number. It's the same thing for all adults.
Okay, very good. What about multisystem inflammatory syndrome in medically complex children? Any information regarding risk of this occurring after vaccination?
Yeah, good question. So no. So MISC, M-I-S-C, is a response that's been described in children who have had COVID, where multiple organ systems are affected. It's pretty serious, and something that's been observed. And that's one reason, again, why no one wants COVID, is because it does cause some of these significant complications. But there's no evidence or thought the vaccine is going to cause MIS-C itself in the absence of actual COVID infection.
Okay, very good. Is it safe for pregnant women to get vaccinated?
So there's limited data on pregnant women and breastfeeding, those that are breastfeeding. The major obstetric OB organizations have said they believe it's safe. There's no reason to think it's not safe. And in general, the guidelines will say that pregnant women should make an educated decision, meaning there's limited data. We don't know for absolute certainty, but we believe it's safe. And so, again, encouraging, if you are pregnant, to chat with your provider, your OB, your primary care provider. And again, it's going to be one of those personal decisions to make. I would say if you're a healthcare worker who's pregnant, then you should probably get vaccinated because you're going to be working exposed potentially to COVID, et cetera. If you, stay at home all day and don't really interact with people and are pregnant, then that's a different conversation. And it's more of a personal decision whether or not to get vaccinated.
Okay. Another question, does an atrial septal defect of the heart count as an underlying condition?
That sounds to me like it would be a significant heart condition. So I would personally say yes.
All right, very good. What about Down syndrome? I have someone asking about their 17-year-old daughter with Down syndrome. Could she get the vaccine?
The answer is yes, that will qualify.
All right, very good. Let's see a few more here. Sickle cell trait, would that be a concern in getting the vaccine? The questioner says their son has this, autism, and asthma.
Sickle cell trait should not be a concern. There's nothing that I'm aware of that has caused an issue with vaccination. And I'm thinking, again, that a number of these trials, tens of thousands of people have been vaccinated in Africa where sickle cell is much more of a problem. And there's been no reports that that's a problem. So no, the answer is no, should not be any concern at all.
Okay. Let's see. We got a call, this person writes, we got a call from BHDDH for our special needs son, age 18, putting him on a list for a vaccine soon, but now we haven't heard anything since then. He has autism and other issues. What should we do? We want him getting a vaccine ASAP. So they get a call about their special needs son, and then they don't know how to follow up. What would be their next step, do you think, Dr. Chan?
Yeah, so good question. So I would encourage people to go to portal.ri.gov and sign up on the state site. I also encourage people, if they have questions, there should be a city or a town contact that people can call. But those are the two ways that I would sort of consider following up. There's a number of mechanisms. The third mechanism I'll just make people aware of is that the pharmacies are actually vaccinating people themselves. So CVS and Walgreens, if you go to their main CVS or Walgreens website, they're getting a separate supply from the federal government, and they are vaccinating people as well. So when the time comes, in a couple of weeks, for those with health conditions, people could also get vaccinated at one of the state sites, or through one of the pharmacies, Walgreens or CVS. Again, they don't have a huge supply, so things are a little bit limited, but people have been getting vaccinated through one of those pharmacy sites as well.
All right, very good. Unfortunately, we are out of time. Lots of great questions. And these questions we're going to forward to our friends at the Rhode Island Department of Health. They asked me to send any questions we don't have time to get to, and they're going to do their best to follow up with the folks who registered for this webinar. I want to thank the Rhode Island Department of Health Office of Special Needs for bringing us this super helpful, super important information. Definitely want to thank Dr. Chan. Thank you, Dr. Chan. This was really great. I want to thank our audience who joined us today. We will be following up with an email that you will be able to access the recording of this webinar if there's anything you'd like to review. Other than that, on behalf of Ripen, I just want to say enjoy the rest of your evening. Thanks again, and take care.